So moving on to sort of the next topic, which is the non-physical aspects of the disease. And I think, again, probably most people on this call understand, or on this webinar understand that obesity causes physical medical problems. They may underestimate the mental health issues that come with the disease. And a lot of that, a lot of the mental health stressors come from just everyday life, but they also come from within the medical community itself. So every time someone tells a person, oh, if you just dieted or ate less or ate better and exercised more, you wouldn't have the weight problems that you're dealing with, that's stigmatizing because that's actually not true. And it makes the person who you're saying that to feel like a failure. So what's more important is to understand, again, the complex nature of the disease, the multiple different pathways that lead to the disease, and then what the actual effective therapies are, because lifestyle changes alone really don't help most people, and especially don't help most children. So there is a video that I put together with a small grant from a local chapter of the American Academy of Pediatrics using my patients, where they actually described what some of their experiences were in doctor's offices, or one of them talks about in medical school, and how awful some of these experiences were. I won't ruin the video for you, but you can find it again on the DC chapter of the American Academy of Pediatrics website. And I can share a link to it for anyone who wants to see it. But hearing how these people, these young adults, were talked about by their pediatricians or primary caregivers is really, really, really sad. And a couple examples, there was a 14-year-old boy who was basically told in the emergency room in my hospital, which you would think would be a more sensitive place, since I worked there and I was trying to educate everyone on the issues with childhood obesity. But this poor boy was just told that he should go to an adult hospital because he just was too big to be treated at a children's hospital at 14. So you can imagine how he felt about that. And then there was a 17-year-old girl who I took care of, who was basically told by her pediatric endocrinologist that she shouldn't worry about her weight because women in her culture just are big. And again, why these sorts of comments are coming from medical providers is unknown to me. But if the folks on this webinar are in training or young practitioners, please, try to work on how you interact with your patients who are struggling with their weight, and check your own internal biases and try to keep them to yourselves, because they really hurt the patients. And what happens when you hurt these patients is you don't get them the care they need, their metabolic consequences worsen, and then their mental health is affected. And about 70% of people with obesity have mental health issues, and then mental health issues can also lead to obesity. So it goes both ways. We also know that adverse childhood experiences like childhood trauma or neglect or abuse can lead to obesity, and that actually can be transmitted through generations, because these risks seem to be mediated by the epigenetic modification of genes, which again can be passed from generation to generation. So young adults, adolescents, children are all in their formative years, and how you treat them as a medical professional can hugely impact their well-being. So again, take-home message is be kind to your patients, be compassionate, and leave your own biases about diseases to yourself, and continue to educate yourselves about how you can be better at your job for all the people you take care of.